Hi, my name is Alyssa and I am an LPN student. Today I'll be talking about two medications. I am doing patient education on these two medications, and the first one will be Synthroid. That is the brand name. And the generic for this brand name is levothyroxine. Usually the generic name is longer than the brand name and it's usually a little bit cheaper. Of course, they have the same purpose. Okay, Synthroid is actually a thyroid medication. It helps replace a hormone that it produces by your thyroid gland to regulate the body's energy and metabolism. You can take it for hypothyroidism, hormone replacement, and to treat and prevent enlarged thyroid glands. You may not able to take this medication if you have certain medical conditions. Just let your doctor know if you have untreated, uncontrolled adrenal gland issues, a thyroid disorder called thyrotoxicosis, or if you had any recent or current symptoms of a heart attack. You shouldn't take this medication with any other medications. Let's say for if you're taking weight loss pills, you shouldn't take that because that is a black box warning. Black box warnings are very vital. Like, they're the main thing you want to look at also and let your patient know. Like this for Synthroid, black box warning is it is not used for obesity treatment or weight loss issues. So you should not take this with any weight loss medications. There are dangerous side effects on death can occur from this misuse of the medication. There are a few ways to take this medication. The first one is oral. There are 12 different types of dosages, tablets for oral. You should take it 30 to 60 minutes prior breakfast. And you should try and take it at the same time every day. They want you to have a routine on it. On the 12 different dosages, your doctor will find the correct one for you. They will also be testing your TSH levels every 6 to 8 weeks. And so it may take a minute for it to actually make you feel anything. Once you think you feel better, please do not stop taking the medication. You are going to take it until told otherwise, okay? They also have powder for injection, which is there's 100, 200, or 500 microgram. And then we have IVs that 300 to 500 microgram. And then some side effects from this medication: anxiety, insomnia, tremors, and headaches. Please contact your doctor if you have chest pain, fast irregular heartbeat, or shortness of breath. Other things that could affect this medication, like absorption-wise, is an iron supplement, Tums, stomach acid reducers, grapefruit juice, soybean flour, cottonseed meal, walnuts, and high-fiber foods. If you become pregnant or you are pregnant, let your doctor know. Sometimes you don't have to stop the medication. They just have to reduce the medication dose. Because I guess when you're pregnant, that hormone goes up. All your hormones go up. So that hormone rises and they don't want it to be over, a certain number. You want to keep it in that normal range. And then for things to consider as a nurse, I'm going to ask if they take any anticoagulants or anti-diabetic agents. I will want to take their blood pressure and pulse before each dose is given. I'm going to assess their cardiac status, like angina, palpitations, chest pains, and I'm going to assess the change in vital signs. This product is not a cure, but it controls symptoms, and that this treatment probably will be long-term for people who take it. That is all on the first medication. So on the second medication is phenergan. Phenergan is the brand name, and the generic name is promethazine. It is an antihistamine, It treats allergy symptoms, motion sickness, nausea, vomiting, pain after surgery, and it's also a sedative or sleep aid. So it has a wide range. You should not take this medication if you have asthma or any lower respiratory tract disorders. Some things can interact with this, and it can give, if you're going to take an allergy test, it'll give false negatives. That's why when you're going to have allergy tests done, they'll want you to stop taking those medications 24 to 48 hours before the date. And it can also give false positives on pregnancy tests. Okay. There are plenty of ways to monitor this this medication. For nausea and vomit, it can be by mouth, intramuscular, intravenous, or rectal. Common doses is 12.5 to 25 milligrams every 4 to 6 hours as needed. For motion sickness, it'll be by mouth, 25 milligrams twice a day, 30 to 60 minutes before departure, like if you're leaving the house and you get motion sickness, or 8 to 12 hours after that PRN. For allergies, it's going to be by mouth, 12.5 milligrams 4 times a day, or 25 milligrams at bedtime. And then for sedation, it's going to be by mouth or intramuscular, 20 to 50 milligrams at bedtime. Now you see, sedation is going to be a higher dose. Call your doctor at once if you are having twitching or uncontrolled movements of your eyes, lips, tongue, face, or arms and legs. These could be early signs of a dangerous side effect. Some side effects are dizziness, drowsiness, poor coordination, fatigue, constipation. And then phenergan should not be used while you are pregnant. It could affect your developing baby. If you proceed to breastfeed, it is excreted into milk, so the baby should be monitored for sedation, irritability, and excitement. Never give a child younger than 2. It will cause severe breathing problems or death. There's a black box warning for IV use. It can cause tissue necrosis, so you'll want to monitor the signs and symptoms for that. As a nurse, I'll assess the respiratory status, the rate, the rhythm, the bronchial secretions, the wheezing, the chest tightness. I'll monitor their input and output. I'll monitor their CBC levels. I'll assess for confusion, fever, sweat, or for rigid muscles. And then that is it for both of the meds. I don't know if it's for all meds, but these 2 meds, the thing I noticed that they both have said is that on both medications, if you misuse a dose, take the missed dose unless it is closer to the next time you should take it. Then you should just wait till the next one because you don't want to double dose. And then if you think you have overdose, there is a poison helpline, and you can call that number at 1-800-222-122. And then that is it, and thank you for listening.